Welcome to On The Beat, everyone. I'm Thompson. Joining me today is Jodi Clements from Chosen to Care Medical Centre. Today we're talking all about fatigue, and it's a topic that I love to talk about because you wake up some days and you're just absolutely exhausted, but you could be deficient in many things. Welcome to the show, my friend.
Nice to be
Nice
here.
to see you again. Let's talk a little bit about some of the common causes of fatigue. I know what they are because I'm a huge advocate of this conversation.
Absolutely. So there are chronic causes to fatigue, such as autoimmune disorders, hypertension, diabetes, those type of issues, as well as vitamin deficiencies.
That's really
huge
important.
Right now.
Yeah.
Absolutely.
I want to ask you, do you do tests, blood tests, to see what vitamins you're missing in your body? Because some people take all these vitamin pills, some of them you don't need, some you do need, and you can overload, right?
Yes, absolutely. Some vitamins that are fat soluble do become toxic if you take too many. So it is very important to look at those vitamin levels, not just throw the vitamins in the mouth. So we do check vitamin levels. Vitamin D, vitamin B12, those are two huge ones that we check, especially when it comes to fatigue.
Well, I want to talk to you a little bit about vitamin D. What are some of the side effects that your body could be showing you if you have a deficiency?
Yes, lots of symptoms. So fatigue is one of the #1 complaints, and we see that almost on every patient coming in, as well as bone pain, muscle pain, sleep disturbance is huge.
I never thought of that, actually.
Yes.
Okay.
One of our #1 sleep complaints is due to deficiency in vitamin D.
And fatigue does not mean you've just been sleeping around all day, right?
Absolutely
it's
not.
lack of sleep.
Yes, absolutely. So the sleep component is huge there. And then the muscle cramps is also one that people just don't realize. They think they have magnesium deficiency, which could be true, but a lot of times it's vitamin D.
Well, what are you doing to help these patients with their deficiencies?
So if it's a chronic illness, we of course treat that chronic disease. Routine visits are very important to make sure the therapeutic level is there for whatever treatment they're receiving. With vitamin D, if it's severe deficiency, it's 6 to 8 weeks of high-dose vitamin D, and then we bring them back in and we're rechecking. With vitamin B12, yes, vitamin B12, we do weekly injections if you're severely deficient. And some patients even have increased energy after one injection.
Oh, I'm telling you, vitamin B shots are the best thing ever invented. Because
I hear that often.
And I get them from my chiropractor because I was low in the vitamins as well. And he said to me, he said, Troy, let's do some tests. And the minute I had my first shot, I'm not joking, within 24 hours, I felt peppy.
Yes.
So you were saying with the vitamin B shot, you see a result within 24 hours, some people, not everyone. Let's talk about those vitamin D. Are you doing an oral pill, or can they have an injection for that as well?
So we do oral pills. That's oral replacement therapy. Something I will mention that's about to come to our clinic is vitamin infusions.
Oh, really?
So yes, we are actually in the process of bringing that to our clinic as well. So
what's the benefit of someone coming in to have that done?
So the vitamin infusions are formulated specific to the patient for the series of complaints that they may have. So it's very patient-based and formulated directly for them.
It's interesting because when I went to have one of them done myself, I was very surprised at the amount of questions that they asked me, and also what prescription drugs that I was on, what vitamins and minerals I was on. And then one of the clinics actually said to me, they said, we need you to get authorization from your medical practitioner. And I was a little shocked, but it did impress me.
Yes.
And I find that quite interesting. So I'm glad you're bringing that to the market as well.
Absolutely.
We appreciate you.
I'm glad to be here.
If you want to find out more information, there it all is up on the screen for you. Chosen to Care Medical Centre. Today we've been talking all about fatigue. Back after this short break.